Hello, dear friends. I hope you all are doing good, and Alhamdulillah, I'm also fine. Although this channel is not linked much with medicine and procedures which are linked with medical, but since I'm a doctor and I've undergone an eye procedure recently, I thought to share my experience with you all because I think that would be a kind of help for all those people out who are basically planning to get an eye procedure done regarding the removal of their glasses, especially the powered ones. Insert video. You might got confused that this monogram is specially linked with Amanat Eye Hospital, and as I got my procedure done from there, so I would share all my experience regarding this hospital because I only had experienced my eye procedure from there, so I can only guide to you all regarding the same. So we are officially going to start our video. I had issue with my vision since when I was almost 11 years old. Um, how it happened and how I got that. Many doctors at that time concluded and they finalized it that this was a side effect of typhoid, which I got almost a year ago before that time, and it impacted my vision at that time. So it started off with minimal eye change, which was like around minus 0.25, and I was only able to see the things clearly to some extent which were far away from me, but I had a strain at that time on my eyes. As I was a child at that time, I could not comprehend easily that what's happening around and what's the exact method that I should tell my parents and my family members that what I'm perceiving. But the major symptom at that time was headache and strain, especially when I used to look at the distant objects boards, like my friends standing so far away from me. So since minus 2.5 is not that much different number, and it was not that difficult for me to visualize things which were distant from me. But even then, I had a strain and pressure on my eyes and a constant headache at that time. And I'm telling this whole story to you all because there must be many kids and elders listening to this video out there. So they should know basically that how they can figure it out, that whether the complaint of the child or the people themselves regarding headache or visual disturbances is linked somewhere with the visual changes that are going on in the eyes at that time. So as far as my bleak memory is concerned, I only remember this symptom. Other than this, I cannot recall that what actually used to happen to me at that time. So after this symptom, after getting my parents used to take me to one optician and ophthalmologist and to the other. Thereupon, from there, I started wearing glasses. Initially, I was fond of wearing them, like it would give me a look of similar to my teachers, and it would make me happy at that time. But after that, I started feeling bad, and I started feeling it as a load on my head and my eyes, and especially on my nose. So the number kept on increasing, and it kept increasing basically till I was at the age of 25 almost. After that, it stopped somewhere in the middle, but at that time my power was increased to the level of -3, and it stayed there for almost many years. Like till now, my number remained -3. And the causative factor, which I could say and I could correlate, is that it's not only the visual disturbance and the changes that was going in my eye within that time period, but the fault was up to the opticians and ophthalmologists too. But I would not blame ophthalmologists in this category. I would blame opticians because I think they could not able to exactly adjust the exact number of my power to the glasses, and therefore whenever I used to wear the glasses, those were new, I felt a strain at that time, and I complained that to the optician again, and they used to say that I'll get accommodated with it with the passage of time. But I think that the powers and the number of the glass which they used at that time, whenever I wanted another pair of glasses, I think that was more than what actually it was required. And my eyes, that's why my eyes felt strained out, and I felt headache in the few days in the beginning, but later I got accommodated with it, and this is how the number kept on increasing instead of staying at one point. And while passing these moments and years, I felt like getting it operated through laser, and it came to my mind a number of times. But due to feeling frightened, I didn't opt that earlier. I was confused that whether I should or I should not. I had heard many conspiracies related to it, that like there one has to keep a strict check on the do's and don'ts, post procedure, pre procedure, and it um, made me frightened, and it led me to not opt this procedure before this point of my life. Then there came the time, which was like in the past 3 years. I met many people around me who got the laser done, and they had pretty good results. So it motivated me too. I discussed it with my family. My family was so skeptical about it, and they did not allow me to get that done. And literally, I also felt frightened and fearful because of the this new technology and this new experience. So I even did not opt it in the last 3 years. Later, I planned it with one of my friends, and she got that done in the previous year, and her results were pretty fine. And because of her, I think I felt motivated and felt relaxed that this is not something which I should delay, and I should get it done as soon as possible. So I had this thing in my mind that in summers the sunlight is so intense, and this would not allow me to like post procedure. I would not be able to face the sunlight, and like I should not. That's why I thought that I should not get it done in the summer months, and then I opted to get it done in the beginning of this year, and all of a sudden it came to my family's mind that I should get myself evaluated. So I got myself evaluated a week earlier. It was Friday, and I went there. I got myself evaluated at Amanatai, and from there the process started off. I also am a doctor, but still I clarified few things regarding the procedures before going to the doctor for eye examinations. As I was basically a regular user of contact lenses, so I searched it that whether it is suitable for me to get myself evaluated, like with the contacts removed a day earlier, or I should remove them a week earlier. So there are clear-cut guidelines that one should remove powered contact lenses almost a week earlier before the eye examination, because that would give the appropriate results. So I removed them and I started wearing I started wearing glasses even when I was going out for work, or even when I was attending any function. Although it lowered my confidence level, but still I went with it, because my goal at that time was to get myself evaluated at the best of my knowledge and at the best of my eye conditions. So I did not focus much on the aesthetic appearance of my personality at that time. So at Amanatai, they perform basically 4 to 5 tests, which comprises of the tomographies and corneal topography, and there are many more examination procedures that are performed. There are some pentagon scans, and they used to examine the eye with the slit lamps, with the dilated pupil, with the undilated pupil. So it starts from the front of the eye and goes back to the back, and behind the eye changes are also examined with the help of those specific tests. So I got myself evaluated, and everything went fine. My corneal thickness was appropriate for the procedure. Few unusual changes appeared in those examinations, which were also new for me. And I again became skeptical about the procedure with the presence of those eye changes. There were some lenticular changes at the margins. So I discussed it with the surgeon, with the manager there, who was also a doctor, and they guided me that I can get my laser done, and these changes are nothing to do with the procedure. So basically, I felt confident at that time. I discussed it with another eye surgeon, and I would suggest you all to do so, because for the personal satisfaction, one should consult another good doctor before getting any procedure done. And I would stress again that one should consult a good doctor, because if you go somewhere to a surgeon who is not that much expert and has no expertise regarding the procedure, regarding the similar procedure, he or she might confuse you or guide you something which would not later on push you to get any procedure done. And because of that confusion, your stress level would raise, and you will not be able to cope up with anything. So I think a good doctor and a good surgeon is much needed for that reason. So I made a call before going to Amanatai for my examination, and they told me that for eye examination, I need not to get any kind of appointment. These procedures can be done like walk-in. So I like manage my whole stuff regarding my job and each and everything, and I managed to reach the clinic, I think, at 3 at that day, and got out at almost 6 p.m. And within that time period, me and my sister got evaluated, because she's also planning to get it done. Although I'm done with each and everything, but she has some issues regarding her leaves, so she'll plan it a month later, I guess. So after 2 to 3 hours detailed examination, they discussed, the surgeon and the sub-surgeon basically discussed different kind of laser procedures that can be performed on my eye. So the options were like, they gave me 2 to 3 options at that time, and the most appropriate options for me was Femto Lasik, and the second was the Topoguided Femto Lasik, which is also called as tissue saving or the Contoura Vision Femto Lasik technology. So I opted for, according to the surgeon's opinion, the sub-surgeon's opinion, I opted Femto Lasik, which was the basic procedure, and it was not the tissue saving procedure. So I was all okay. I came back home. I planned my whole schedule, and then I planned to get the procedure done on the next Friday, on the coming Friday, basically. So that was on 17th March. I got my procedure done on 17th March. I went there. They performed 2 to 3 further examinations, and they clarified my eyesight again, because that was something which was much needed at that time, because they have to enter those values into the laser machine, and the laser machine was automated and topo guided, and it had to fix its parameters and findings according to those figures. So for more qualitative and quantitative results, that was required to get my eyes evaluated again without dilating my pupil. I discussed the options with the main surgeon, who was Dr. Amir Israr, and he suggested me to go for the topo guided version, because he suggested that this is more appropriate and more up-to-date procedure in the category of the Femto Lasik. So I was all prepared mentally and financially for that procedure at that time, and I immediately made a decision. The procedure was so smooth, Alhamdulillah. It went so well. Before taking me to the OT, they took me to a room where they washed and sanitized and clearly disinfected my face and eye area. They, with the help of alkane, numbed my eyes and anesthetized them with the topical anesthesia, which was alkane basically. They helped me wearing a gown. They put a cap on my head to cover my hairs. They put some ear covers basically to cover the ear studs which I was wearing, just for the sake of safety. Otherwise, nothing was linked with the metal presence. So I was okay, and I was given 2 pawn stones before the procedure. Then I was taken inside on my turn. I got myself relaxed there. The assisting staff was even so helpful. They helped me to adjust and sit on the table, on the OT table. The subsurgeon took a photograph of my face before the procedure, just for the sake of memory. And then they asked me to lie down. I lied down. They adjusted my head. They guided me all the instructions. The procedure of my right eye was started in like before, and later on the second eye was done, and it was the left eye which was basically done on the second turn. So it all was made within the timeline of 7 minutes and 30 seconds, and I was done with both eyes at that time. During the procedure, the staff gave me stress-free balls in my hands, just to divert my attention by squeezing them in the case of nervousness or the stress. So I was good at that time. I felt good. I felt okay. I was a little bit nervous in the beginning, but later I got myself accommodated with each and everything that was happening with my eyes. After the procedure, they assisted me to sit on the bed, and then assisted me to move to a chair and a stool where my eye was examined again. The main surgeon examined my eye in the slit lamp, after the procedure, to see that isn't there any issue that is remaining in the eye within this eye itself. So he was all sure that Alhamdulillah the procedure went well and whatever he wanted to achieve was achieved by that time. Then I was given a box of juice at that time, to I think make me feel like my glycemic index is going appropriate and in the normal balance. After spending a few moments in the OT, they took me out. They asked me whether I wanted another like Ponston or not, and I refused to take it because I already had taken two Ponstons before the procedure, and it was not painful by that time, so I refused that. After a few moments, and they put some drops in my eyes, which were antibiotic and steroid based, and after that they assisted me removing the gown and the cap and the ear covers, and helped me wear my dupatta and scarf, and guided me that not to take my hands or anything near to the eyes, because they were too sensitive at the time, and they were like having redness and irritation too. I was scared of one thing because when I was when the procedure was done, I felt a constant irritation in the right upper eye quadrant and upper corner of the right eye, which was not much, but it was like irritating at that moment. And my left eye responded so well that I felt nothing in that. Even I didn't feel anything that whether any procedure has been made in that eye or not. It was so normal, alhamdulillah, at that time. So after that, I came out. The staff guided me the medicines and told me that how to use them. I spent a few minutes within that clinic, and my family went and brought some medicines that were prescribed by the doctor. Then I came back home. By 6, I was at my home, and one thing that I should guide everyone out there, whoever is going to plan to get this procedure done, is that one should keep one's eyes closed after the procedure, because the watering of the eyes and the irritation is something very much normal, but it can be minimized by keeping your eyes closed. I followed this thing. I was not guided by someone else. Even then, I felt good to keep them closed, and luckily, because of this, I didn't feel much watering of my eyes and irritation, except that irritated spot in the upper right quadrant of my eye, which was totally fine by 8 p.m. So technically, my procedure was made at around 3:10, or you can say 3:15. It started off at 3:07 or 3:08 and ended at 16 minutes or 17 minutes past 3. So the whole procedure time was like 7.5 minutes, as I already told you earlier, like for the both eyes. Then between 6 p.m. and 8 p.m., I almost fell asleep for 5 to 10 minutes for 2 to 3 times. And I think when I woke up by 8 p.m., my irritation was gone. The tearing of eyes was stopped by that time, and I felt really okay. My vision was perfectly fine. I was unable to open my eyes completely, that because I was feeling a burden on the upper eyelids. I was not able to easily open my eyelids, but whatever was visible in a short visual field of mine, I was able to see them clearly, alhamdulillah. So I ate my dinner, I took the medicines, and I didn't had any Ponston after the procedure, although it was prescribed by the doctor that I if I wanted, I would like take 1 or 2 Ponstons 4 hours after the procedure. But I didn't feel anything, so I didn't take them. And it was also prescribed by the doctor that I could take Xanax or any kind of sedative. They have given me help, but initially I was planning not to take it. Uh, like, but later I decided to take a fourth part of it so that I can sleep easily and calmly. I took that and I woke up so peacefully, and I was like painless in the morning. Even I felt a mild irritation again, but that was because of the dryness of my eye. I used my drops and I was again perfectly fine. So I would suggest anyone who is wearing glasses and want to get rid of it, that the technology is so good these days and so advanced that you can get your glasses removed with the help of such painless and minimally invasive procedures, and you can clearly experience the world without glasses. And these were my recommendations, my whole story, my whole experience regarding the procedure. I'll be adding more videos on the same, whatever will come up to my mind. For now, I think that was something which I wanted to share with you all. I'll be highly glad if you wanted to ask anything, and I'll be highly glad to answer them all. So just pray for my complete recovery. Since the procedure time, it's I think my second day and third day has started. So like after tomorrow's 3 p.m., I'll be completing 3 complete days post procedure. So just remember me in prayers, and I'll be coming back with more informative videos for all of you, hopefully, inshallah. So stay tuned and subscribe to this channel, please, and hit the like button as well. Thank you so much for all your support and all the prayers. Goodbye.